I am very pleased to have in the studio with me Dr. David Hochberg. He's got a real PhD. How cool is that? I just have an honorary one. Okay. Yeah, Dr. David Hochberg, healthcare policy analyst with the National Center for Public Policy Research. Nationalcenter.org is the website. And David, in the United States, administrative costs associated with our healthcare system represent 31% of total costs, total health spending. In Canada, it's 1.3%. Aren't we being wasteful by not adopting a single-payer system like Canada has?
Well, no, because I think the greater issue is how patients fare under single-payer systems like Canada. Canada, for example, the wait time to get treatment is now up to 19 weeks, which
depends entirely on the condition. If you have something that's acute in Canada, you will be seen the same day. If you have something that is long-term in the United States, you will be put on a wait list too.
Well,
say,
here's the website for the British Columbia that you can go to, and here is a body
Surgical
chart.
times.
You can click on the body part, and it'll tell you what the various wait times for surgery and including things like cancer treatment are in the
But the same
in
thing
Canada.
is true in the United States.
Well,
I have a friend who just had a hip replaced. He had to wait a year for it.
and those waits are common in Canada.
They're common everywhere. You know, having a hip replaced is different than having had a heart attack. If you have a heart attack in Canada, they will see you the same
But moving to single
day.
payer doesn't really solve the problem, then, does it?
Let's define the problem. The problem that I'm seeing is that Stephen J. Hemsley, the CEO of United Healthcare, has made over $1 billion as the CEO of basically a banking operation. He's a bankster. All they handle is money. He's never given a single vaccine to a single child. The guy before him, Dollar Bill McGuire, made $1.7 billion as the CEO of a health insurance company. These guys are skimming your money and my money off the top to the tune of almost a third of everything that we're spending is going into the pockets of these banksters who run these health insurance companies.
That's not the real problem.
Condemnation of Obamacare.
The real problem is we are giving more and more of the control of our healthcare system over to politicians.
How?
And Obamacare is the latest one. And
wait a minute, how? Obamacare
what do you mean,
says,
how?
Well, I'll give you some examples of how Obamacare actually is controlling healthcare. They're saying to the insurance companies, no, you can't dump somebody after they've hit $1 million, like they used to have $1 million cap on it. They're saying to people, no, you can't do rescission. You can't dump somebody just because they get sick. They're saying you must allow kids up to 26 to be on their parents' policies. That's government interfering in the healthcare marketplace. It's an interference
which has resulted
welcome.
in much higher deductibles, skinnier networks, people having trouble keeping doctors even in their own insurance plans, as was clear in that New York Times article. No, the problem is
31%. That's overhead going to these other and I mean you compare this to other countries: Canada, England, Scotland, Wales, France, Germany, and the Netherlands,
all of which have major,
which have better outcomes, better health outcomes than the United States. They have lower infant mortality,
neither of which tells you anything about a healthcare system. There are a number of factors that influence life expectancy, the healthcare system being only one among them. On infant mortality, that is measured so inconsistently from country to country. You're supposed to count any infant that makes any attempt at breathing, basically. There are only two countries that follow that definition, Canada and the U.S. And guess which two countries have the highest rates of infant mortality? Canada and the U.S. When you look at things that the healthcare system does have more impact on, such as cancer survival rates, the 5-year survival rate, the U.S. tends to be near the top.
And we are, A, we're near the top, but B, we have more cancer than in a lot of other countries. I mean,
what's the evidence for that?
If you have more, I'm sorry, I don't have the paper with me, but well, let's set that one aside. I can't back that up right now. But back to this, what's your alternative? If Canada, England, Scotland, Wales, France, Germany, Netherlands, et cetera, if they can run a healthcare system,
they can't run a healthcare system
at less than 5%. And it's costing us
this is how-
31% to run our healthcare
This is
system.
how they do it. I mean, they end up with 3.2 million people waiting for treatment. This is direct data from England. They have about
There's millions of people in America waiting for treatment.
763,000 people waiting for diagnostic tests.
Millions of Americans
and
waiting.
nearly 16,000 people who end up having their surgeries canceled in
This is true of the United States as well,
in the
David.
UK, it's not recommended that you have more than 62 days between the time you're diagnosed with cancer and the time you get treatment. And according to the Daily Mail, the last time they checked, 10,000 patients in the UK exceeded the 62-day standard. So that's how they keep costs down in the UK. By shoving it on the sick people. And the reason they do that is because sick people don't have much political clout. They don't amount to that many people come election time. They are certainly in no condition to be protesting, organizing, and doing the things that can change public policy.
And why is it that the conservatives in England defend the National Health Service? And let's just be very clear. I'm talking about single payer. The NHS in England is a socialized system. Doctors in England work for the government. Doctors in Germany don't work for the government. In single-payer systems, doctors are not government employees. They're
not government
contractors.
employees in Canada, and they still have many of the same problems with wait times and wait lists and so forth.
Canada's doing great. People in
they're
Canada
not.
love their healthcare system. Their most popular historic politician is, what was his name? Tommy Thompson or something like that? The guy, say what? Tommy Douglas. That's right. The guy who started this thing in Saskatchewan. He's like the national
You're
hero.
conflating popularity with effectiveness. I mean, just because something's popular doesn't mean
it's popular
it's
because it's effective.
No, it's not popular because it's effective. I mean, it is not effective when you have an average wait time of 19 weeks to get surgery. It's not effective
for non-critical surgery.
Well, no. According
you have
to
the same here in the United States.
According to the Fraser Institute, about 44,000 people died because they were, over a 16-year period, which is about 2,700 people in a yearly, which in a country of about 30 to 35 million people because of wait times.
Well, and in the United States,
and again, I'm sure it's popular because most people don't get that sick in a year, and hence, all they know about the healthcare system is, maybe I get to see a doctor.
And in the United States, university, you've got 44,000 Americans who die every year simply because they have
that's not
access to
the
healthcare.
Harvard study. That's the study put out by the two doctors that founded the National Physicians for National Health Program, which is the single payer advocacy group. If you actually look at the studies that have good study designs on the effect of mortality and health insurance has on mortality, there are 5 studies that say yes, it do. There are 4 studies that say it don't.
You're trying to argue on the one hand that the Canadian system, which has some weights in it for non-critical care, is leading to death. In fact, the effects of mortality in Canada. And then on the other hand, you're also arguing that it doesn't matter if you're insured or not. That doesn't change mortality. Really?
Yeah, actually, I am arguing that because the people who are on the waiting lists in Canada and England are actually sick. Whether or not you have health insurance
What if they have
is
no
not
health insurance at all?
Well, they don't really have health insurance if they're on.
Then how can you say not having health insurance isn't a risk for death?
Because most of the people who don't have health insurance are not sick.
What does that have to do with?
It does, because you're saying there's a direct link between health insurance and mortality, and comparing that to this and to single payer, and the people who are waiting on single payer genuinely